Hi, I'm Dr. Karen Feeny, and I'd like to talk a little bit about ear infections. So ear infections are one of the most common reasons why kids visit their pediatrician each year. It's also one of the most common reasons kids get prescribed antibiotics. The age group that's most commonly affected are from the ages of 6 months to 2 years. After that, it diminishes, but there is an increased incidence also in kids just entering school for the first time at age 5 to 6 years old. After that, the incidence decreases with age, and it's much less common in adults. So some of the reasons kids can get ear infections are increased exposure to smoke. This is increasing the risk. Also, kids that use pacifiers for greater than 6 months, and kids that have not been vaccinated with the pneumococcal vaccine or flu shot. The other thing that can help decrease your incidence of getting ear infections is breastfeeding, again, greater than 3 months, and also getting the vaccines. The reason that ear infections develop is usually fluid that backs up behind the middle ear, and this happens because usually the eustachian tube, which is the tube that connects the middle ear to the back of the throat or nose, it gets clogged. And the most common reason that people have this is from the common cold. It can also happen from allergies. So what happens is the fluid backs up, and when it gets infected, this causes an ear infection. So the most common symptoms that adults and older kids can have is ear pain. They can also have a muffled or diminished hearing in that side of the ear, possibly a fever, and sometimes dizziness. But infants and young children will often tug at their ears, and infants can be very fussy. They won't want to feed well. They can also have vomiting and diarrhea. So if you or your child have those symptoms and come to the clinic, the practitioner will examine you and will look in the ear. And some of the things we look for is a red eardrum, and also we see bulging of the eardrum, which is usually caused by the fluid that's behind the ear. If we see those things and diagnose you with an ear infection, the common treatment for ear infections is antibiotics, and the most common antibiotic used is amoxicillin. That is, unless you're a child or an adult that have had recurrent ear infections. Now, for certain populations of kids that are older than 2 years old, there can be the wait and watch approach. What happens with kids that are older than 2 and have symptoms on only one ear, and they're very mild symptoms and they're otherwise healthy kids, we will prescribe antibiotics but give the parents instructions that if the child is not improving or symptoms are getting worse in the next 48 hours, they're to start the antibiotics. The other thing we use to treat this is pain relief, and most commonly this is done with ibuprofen or Tylenol, but occasionally adults will have significant pain and they might need something a little bit stronger. So most people recover without any problems from ear infections. So if you or your child have symptoms, please come down to GoHealth Urgent Care. We'd be happy to see you.